Hey everyone! As promised, we're here on the live stream and we're here with a coronavirus expert to answer all your questions and concerns about the coronavirus. So I'm going to wait for a little bit so people can join. But I'm going to be speaking with a coronavirus expert who I will introduce in just a second. And any questions that you have, feel free to leave them below as well. And we have a couple other questions from people who have submitted them to CBC Kids News at cbc.ca. So if you have any other questions later on, you can totally submit them there. So there's a couple people here. Hello, everyone. So I am here with Kathy Egan. She is a coronavirus expert. Kathy, why don't you introduce yourself to those who are not sure who you are?
Certainly, happy to. I can't really say that I'm a coronavirus expert because it's such a new virus that's been around, but I call myself an infection prevention and control expert. And what you learn about in infection prevention and control are the principles of how things are transmitted, and then you can apply that when a new virus emerges. So my background is I've been a public health inspector for about 15 years, and then I went to Public Health Ontario, where I was only working in infection prevention and control. And then I've been a professor at Conestoga College for the last 4 years, and we train people to be public health inspectors. So short plug, if anyone is fascinated by this whole pandemic, coronavirus thing, and you want to do something useful like this for a career, check out the Conestoga College Bachelor of Environmental and Public Health program because it really is amazing. I've loved doing this as a career, and right now if I didn't work in this field and didn't understand things, I wouldn't feel as calm or even as helpful as I do because I get to work and help support the response. So just a small plug for working in public health. And that's me.
Incredible. Thank you so much. So I know something that a lot of people are wondering is how long will this really last? Can you give us an approximate answer? I know it's really hard at the moment to dictate whether it's going to last a couple months, a couple weeks, a year, who knows?
Right. It is very hard to dictate. What most of the experts and the people who are really expert and they understand how to do disease modeling, doing all kinds of computer simulation, what they think is that this will go on for months and this virus might even end up circulating in our world forever, like influenza does. Now, that doesn't mean it will be as intense as it is now, because once some people get infected and recover, they will be immune. And if we can develop a vaccine for it, and we think that might happen in about 18 months, so like a year and a half, then we might be able to prevent some cases by using the vaccine. But this virus might be with us like influenza is with us every year. But we do hope that, the first wave of it will be finished in a few months. Once we release ourselves from this isolation, though, we might see additional cases and have another wave of it.
Interesting. So many people have been speaking about the curve. This is a term that we hear being tossed around. Now, what exactly is this curve, and has Canada improved in planking the curve at all?
Right. So the curve is, many of you have probably seen it circulating on social media and various places. It's a curve that basically goes up like this and goes down. And if you remember what you learned about graphs, we know that we plot time across the bottom and the number of cases on that's the y-axis, right? I haven't actually given it a name for a long time. So what it means is over time, you see a lot more cases. And picture it like if you had the virus and then you gave it to two friends, and then they gave it to two friends, and they gave it to two friends, that's what makes the curve go up. So by everybody staying at home, and hopefully nobody giving it to anybody other than the people who've already been infected, we should see that curve, instead of going straight up, it should start to kind of drop off like this. And so planking the curve or flattening the curve is what people are saying we need to do now. And we won't know if that's been effective just yet. We have to wait for a few more days, maybe even another week, before we can say that what we've been doing is going to be effective. And the thing that you want to do, you may still get people getting infected once we come out of our social isolation. because we're not immune, right? If we haven't been exposed to it, we might get exposed. But if we can flatten or plank that curve, it means that we will have, instead of a whole bunch of cases all at once, just a more manageable number of cases. Because in addition to people getting sick and us being worried about people being sick, we have to make sure we don't overwhelm our hospitals, because then we don't have appropriate care to help people who are sick. So if we can plank that curve and get the number of cases to be fewer, probably not zero for a long time, but fewer, then we can manage them appropriately in hospitals.
That is some key information. Thank you very much. Now, as a young person, I know a lot of my friends and I even are concerned. There's a lot of information going around about how young people are immune, or young people, if they get it, they're not really going to get that sick. Now, what is the importance of kids staying home? And if a kid does have the coronavirus, like let's say if I get the coronavirus, what should I be doing? And, what precautions should I be taking?
Right, great question. So yes, there is some evidence, and I say some evidence because we've only known about this virus since January, right? So we are still learning a whole lot about it. But many cases in children are either very, very mild, or they don't even show any symptoms. And so that's good news for kids. We're not sure why that is, though. We don't know if it is an immunity or if there's some other reason that it just doesn't affect them. So we're still trying to figure that out. But the risk is if you're a kid and you have the virus and you don't show any symptoms, you could still pass it on to somebody else. So if you're visiting your elderly grandparents or an elderly neighbor, or if your parents have an immunocompromised illness, then you could pass it on to somebody else who could get very, very sick. And so even though you might feel fine and think, I want to go out and play with my friends, this is why we're all staying home, because even if we don't show symptoms, we might have the virus in us and we don't want to spread it to anybody else. Oh, so the precautions you can take are the things that you've been hearing about on the news, probably to the point where you're tired of hearing them now. Wash your hands. Don't touch your face. Now, the reason you don't want to touch your face, and it should be don't touch your face with unwashed hands. Like if you have a really itchy eye and you really want to rub it, wash your hands really well, and then it's okay to touch your eye. But don't touch your face when you're outside, and I say outside, I really mean like at the grocery store or something like that. Because if you touch all the surfaces that might be contaminated and then you put your hands to your face, you can put the virus right into your body. And it gets in through your eyes, your nose, and your mouth. It doesn't get in through your skin on your hands. It's that your hands touch everything and pick up the coronavirus and all kinds of other viruses. So if you want to talk about diarrhea and how it's infectious another time, give me a call back and we can chat about that, because dirty hands give us diarrhea too. So always wash your hands. So wash your hands, don't touch your face unless your hands are really clean. Stay home if you're sick for sure, and we've been advised to stay home regardless because we want to make sure we don't spread it to other people. And those are the main messages.
Of course, I know I'm staying home, especially for people like my grandparents who are older, or my parents who are immunocompromised. So for sure, some great advice. Now, we have a couple questions from some CBC Kids News viewers. This comes from Heather. She's asking, what happens inside the human body when a person catches the coronavirus?
Great question. So, as I said, it comes in through your eyes, your nose, or your mouth, and then the virus goes to the back of your throat where it starts to get into the cells back there, and it starts to replicate or reproduce or multiply. So it needs to get inside your tiny little cells, and then it multiplies a lot. And then it starts to go down your bronchial tubes and starts to get into your lungs, where it can cause inflammation. And then if it's a very severe case, it can cause fluid in your lungs, and it gets really hard for the oxygen to get into your lungs and then get to the rest of your body where it needs to be. So that's why when you get a swab for it, it's either a throat swab or a nasopharyngeal swab, where they stick it right up to the back of your nasopharynx, which is the back of your nasal passages basically. They twist a little Q-tip around and scrape out some of those cells so they can look at it under a microscope and see if there's any of those cells that are present.
So we have some people asking on the live stream now, once you get the coronavirus, what are symptoms you may experience? Great
question. So as we mentioned, if you're younger, you might have no symptoms at all. It might be mild, so a runny nose or a little bit of a cough. Some people are saying that they lost their sense of smell, and that's the only symptom that they had. So that's a new thing that we've not really recognized with any other viruses that have been circulating, to my knowledge. Okay. So that might be one symptom. Some cases have had a bit of diarrhea, but this traditionally, and when I say traditionally, again, it's only been since January, but from what we know, it's usually respiratory. So I've just described mild symptoms, but then you might have shortness of breath, trouble breathing, and pneumonia if you end up getting a very severe case.
Right. Now, there's another question from a CBC Kids news viewer. Her name is Ashley. She says, if I show no symptoms after I've quarantined myself for 14 days, is it 100% guaranteed that I'm not a carrier?
That's a great question. And one thing in public health we do is we never give a 100% guarantee for anything. Sorry. It's a very good chance that you don't have it. The reason that there's that 14 days is if you come in contact with the virus, let's say right now, it takes a little while for it to do all those things that I mentioned. So to get into your cells in the back of your throat, to start to multiply, to start to cause symptoms in a person's body. And so most of those cases happen within 5 to 6 days. So even if you're in your 14-day isolation period, if you've made it over 5 or 6, it's a pretty good chance that you're going to be okay. But we need to wait that 14 days because some cases do take a little bit longer. And the longest incubation period we've seen is 14 days. So it's not 100% because there's often outliers of anything, but there's a pretty good chance that you did not get infected from an exposure before that 14 days. An important point to think about, though, is once you come out of your self-isolation and you start to have contact with people again, you can get re-exposed, and then that 14-day time starts over again, right? So the 14 days is only from your first time that you came in contact with the virus.
So that's a great point. So you can still get the coronavirus once again if you've already had it.
Correct. No, not exactly. So that 14 days you would do if you were potentially exposed. So the people who are coming back from traveling from other countries, right, even the States. So you're coming back from Florida, you have to isolate for 14 days.
Right.
Because if you came in contact with it then, you would show symptoms within that 14 days. Okay? Mm-hmm. So then you're fine at the end of that 14 days. That means you probably didn't get it, or if you did, you're asymptomatic. Okay? But we're kind of assuming that that means you didn't get it. But once you leave your isolation, you may have the opportunity to be exposed to that again, and you may come down with the symptoms then. Does that make sense?
Yeah, of course. So just to be extra careful even when you think that you haven't got the coronavirus and you go outside.
Yes, correct. And just because you've been inside for 14 days, that doesn't mean you'll never ever get it again.
Right. So just because you've been staying inside doesn't mean you're never going to get it.
That's right.
So we have a question on the live. Isabel is asking, how long does the virus live on a surface? I know this is a question that a lot of people are wondering.
That's a great question. So I'm also doing my PhD in environmental disinfection in the home. Awesome. And so I know this question off by heart. So it probably doesn't live very long. It probably could live about 2 to 3 days, and it depends on the surface that it's on. It also depends how much mucus or spit or phlegm is there too, because if you're sick with it, how it comes out of your body is through droplets when you're speaking or sneezing or coughing. So imagine sneezing out onto your keyboard or something. The virus could actually live there for 2 to 3 days. Sometimes they've said even up to 9 days. But it's just like when I was saying before, there is sort of a guideline, a general guideline, and then there's sometimes extremes of that. But that's why we recommend also doing environmental cleaning of commonly touched surfaces. So for sure, clean your phones. Use just alcohol wipes to clean them, or Lysol wipes. You should clean your keyboards. You should clean anything that you touch a lot and that you share with other people. The remote control for your TV, all of those things should be cleaned.
Doorknobs, everything.
Yes. Yep.
So some people are asking, is it necessary to wear masks outside?
So no, we think it isn't. Masks are most effective if you've got a cough yourself. And it's like if you're sick, you put the mask on if you're going on your way to the hospital. Now, having said that, though, there's some evidence that in South Korea, where they wear masks a lot for air pollution, they were able to keep their cases down. So I'm saying that to you today, that we don't recommend, if you're well, to wear a mask outside, but evidence might change and we might learn more that it actually is a protective thing to do. But right now, we don't want people wearing masks outside. We want to save those for our healthcare providers because they need them when they're dealing with sick people.
Great. And one last question from the live. Adam is asking, if someone has COVID-19 and they fully recover, can they get COVID-19 again?
That is a great question that we do not yet know the answer to. So you know how sometimes you get a cold one year and then maybe the next year you don't get it, but the year after that you do get one? So coronavirus, there are lots of different kinds of coronaviruses, and some common colds are caused by coronavirus. So at this point, we don't know if you could get this one again. Many respiratory viruses, after you have them, you can have immunity for a short time, but you may, in subsequent years, be exposed again and then get sick again.
Now, there is actually one more question that I think we should answer.
Sure.
There's, can we wash our gloves and reuse them? I'm guessing
Never
that's a
wash
no.
your gloves. Never, no.
Great.
No. I mean, that's a great thought if you're thinking that we have a shortage or they're becoming scarce, but it's not safe to rewash gloves.
I'm glad we clarified that. I was thinking that answer was a no. Okay, so I know things are really tough right now, and a lot of people are having a hard time with staying inside. A lot of people are really anxious and scared. So I thought we could end off with something fun, just to kind of lighten the mood and help everyone just calm their nerves. So I have a fun little hashtag quarantine life Q&A to wrap up. So while physically distancing, would you rather learn how to play an instrument or read all the books on your reading wish list?
Oh, read all the books on my reading wish list for sure. And my husband's learning how to play the trumpet, so imagine how excruciating that is while I'm trying to read and he's trying to play the trumpet.
Yeah, that doesn't really complement each other. Okay. This is one of my favorite questions. What is your favorite snack to have while quarantining?
Oh, definitely those mini eggs, which I kind of wish I didn't have any more in the house right now because I think I'm definitely eating too many of them, but just love the crunch of those mini eggs.
Okay, and what's one cool movie or TV show or book that you've read while staying inside?
I haven't yet seen all of Brooklyn Nine-Nine, so we started watching that recently, and I have to say it's been great to have a bunch of laughs and just silly laughs so that you don't have to think about all of the other things that are facing us right now.
All right. Do you have any would you rather questions for me?
Oh, well, I was wondering about your favorite snack, actually.
My favorite snack? My mom got some pretty awesome snacks for us. She did stock up on some chips, so those have been really great. But I've been trying to snack on some healthy things because it can get really easy to just put on Netflix or while you're doing your homework, just snack on some unhealthy stuff. So I've definitely been having a bunch of apples, that sort of stuff, just to try and keep healthy. But don't get me wrong, there's a lot of snacking.
I think that's okay, as long as it's a good balance.
Yes, of course. Well, thank you so much, Ms. Egan, for joining us today and informing the CBC Kids News audience on the proper practices around coronavirus and just their overall questions. You've been a great help. The information you provided was absolutely incredible. So thank you so much for sharing your knowledge.
Thank you for having me.
All right. I'm going to say bye to the live now. Thank you guys so much for tuning in. I'm sure we'll have many other lives in the future, but I just wanted to say thank you. And if you have any more questions, as always, submit them to cbckidsnews@cbc.ca. I'm Sarah Chaudhry. See you next time. Bye.